So one of the questions I get asked a lot is, what is filler? What is it? What are the different kinds? What are the pros? What are the cons? So today I'd like to take a few minutes to talk about filler. Filler does just that. It fills. Almost all of them are hyaluronic acid based fillers, meaning it's based primarily off of a molecule called hyaluronic acid. This is something that exists naturally in your body, and it is broken down by your body naturally over time. Now, the nice thing about HA fillers are that they can be dissolved. There is something you can get called hyaluronidase, which dissolves all of these hyaluronic acid based fillers, which is nice because if you have an issue with something, there's a problem, you can always dissolve it. Now, it's important to know that there are a lot of different types of fillers. Just because somebody says Juvederm or somebody says Restylane doesn't mean that it is a specific type of filler. Juvederm makes 5 types of fillers, ranging from very soft to very hard or very thick. So if somebody says Juvederm, you should always ask, well, what kind of Juvederm? So what does it look like? Well, this is a syringe of Juvederm Velour. It is one of their newer products. It is about medium thickness, and when you take it out of the syringe, it flows like a clear gel, and when you look at it, it's a clear gel, and all it does is it just takes up space. Now here's the really important question that I get asked is, how long does it last? The real answer is never as long as you want it to. A lot of the boxes will say 18 months, 24 months. In my experience, it's never that long. It's on average 6 to 12 months. In the lips, it's a lot shorter. It's usually 2 to 3 months, and some people don't even get that long. Now, an important decision to make is what kind of filler. If you've decided on Juvederm, what kind of Juvederm? In general, there are thicker fillers and thinner fillers. So thicker fillers are going to be things like Voluma, things like Ultra Plus. On the thinner side, it's going to be something like Volbella. Now the trade-off is the thicker the product, the more powerful it's going to be, and the more likely it is going to be to have little contour irregularities like lumps and bumps. So for deeper injections like the cheek or the chin, a thick product works great, and it's probably going to last you longer than a thinner product. Now around the mouth, you need a thinner product because you're much more likely to have contour irregularities with a thicker product since the injection is much closer to the skin. Now for lips, a lot of it depends on your goals, and patients that want a very full lip probably are going to use a different product than somebody who wants a more subtle change. Also, a thicker product in the lips is going to be at higher risk for contour irregularities and lumps and bumps versus a softer product. It's really good to talk to your provider, your injector, to decide which product would be best for you in your specific area that you want, just because it really depends on what your goals are as well.